It's time for the 420 Radio News, covering the latest headlines in consumer cannabis, medical marijuana, and industrial hemp. Transcripts of 420 Radio News are available daily on our website at 420radio.org. Now, here's Priscilla Simon.
Hi folks, it's your 420 Radio News for Thursday, July 10th, 2014. A new study of actual sales figures for marijuana in Colorado has yielded a market demand of 130 metric tons per year. A metric ton is 1 million grams. The new estimate is a third higher than previous estimates that had relied on self-reported use and questionnaires. 121 metric tons represents the annual demand for marijuana by Colorado residents, meaning residents of the Centennial State consume 10 tons of marijuana per month. Visitors to Colorado racked up another 9 metric tons of annual demand. These figures represent both medical and recreational use of marijuana that goes for an average of $220 per ounce. In Denver, visitors make up 44% of recreational sales, but at ski resorts and other vacation spots, visitors make up 90% of demand. About 9% of Colorado residents are consuming marijuana at least once per month, with 22% of those cannabis consumers using 70% of the marijuana in Colorado. Very few medicinal consumers made retail purchases, leading the study authors to conclude, quote, "The retail demand is derived primarily from out-of-state visitors and from consumers who previously purchased black market or illegal weed." Colorado has collected $34.8 million in marijuana taxes and fees so far this fiscal year.
That's fantastic news, and I'm not surprised that the actual consumption is greater than what had been estimated previously. I mean, for one, you're asking people to, talk about their marijuana use when it was previously illegal, and that, people are going to underestimate. And then the other problem is when you're loading a bowl, do you weigh out each bowl or each joint before you use it? No, I mean, since it hasn't ever been, consistently packaged and labeled for how much you're getting, it's always been difficult for us to estimate exactly how much you're using. I mean, how much do you put in a bowl? 0.3, 0.4, 0.5? It varies, and so it's really hard to keep track of that.
It depends on the bowl.
Yeah, exactly. What kind of bowl, how many people are involved, how long is the paper? I mean, yeah, it's hard to figure out. This average of 220 an ounce, does that ring true to you, Priscilla?
Yes.
That's about right. Yeah, about 220 an ounce. And that's not so bad with taxes and all that. I know the folks in Washington State are freaking out over, $480, $500, $600 ounces, but that's going to come down once there's more production, once there's more supply. The other interesting thing in here, this 22% of cannabis consumers use 70% of the marijuana. That's us. That's the hardcore, daily users, right? But it does go along to that 20-80 theory that had been floated many times. In just about anything, 20% of the X accounts for 80% of the Y. This is something you find in economics textbooks all over the place. So it looks like it's bared out pretty well there for marijuana, although hard to determine how much of that is going to change as people get more accustomed to marijuana. But 9% of Colorado residents using marijuana, that still comports with what the annual surveys have found. Colorado's always between 9 and 10% of annual use for marijuana. And finally, that we find that the retail demand is derived primarily from visitors and people who previously purchased black market or illegal weed. Just as legalization was intended to, it's taking people off the black market and putting that money into our tax coffers.
Right. The Massachusetts Supreme Judicial Court has thrown out the conviction of a man busted for weed based on its smell. In 2 unanimous rulings, the justices said the decriminalization of 1 ounce marijuana in Massachusetts in 2008 means that the odor of fresh marijuana cannot be used to justify a warrantless search of a person's car. In 2011, the court unanimously ruled that police couldn't justify a search based on the smell of burnt marijuana, since that smell couldn't validate that a person held a criminal amount of marijuana over 1 ounce. On Wednesday, the court applied the same logic to fresh marijuana in a case where a man was pulled over and found to have a baggie of marijuana in the glove box of a car he had just crashed. Based on, quote, a very strong odor of unburnt marijuana, end quote, police searched and found a backpack containing much more than 1 ounce of marijuana. The court ruled that the police couldn't possibly distinguish between a decriminalized ounce and a criminal amount by scent alone. Furthermore, the court ruled that the federal illegality of marijuana makes no difference. Police may not search based on marijuana smell alone.
This is something I've tried to tell people ever since Prop 19 back in 2010, and I'd hear people complain, oh, it's only an ounce. They're only legalizing an ounce. Well, this is decrim of an ounce. This isn't even legalization in Massachusetts. We're talking decrim. And when something's decrim, that means it's just a civil penalty. It's no longer technically a crime. So if you got less than an ounce, it's not a crime. If you got more than an ounce, it is a crime. And the court just reasonably said that a cop's nose cannot sniff the difference between under an ounce and over an ounce. That's what the cops were trying to say. This guy had wrecked his car, and they, searched through the car in the glove compartment. They found this baggie of weed, right? Just enough to be a decriminalized amount. But they said that the overwhelming odor of marijuana was so strong that they had to go search the rest of it. And that's when they found the backpack, and they found the much more than an ounce that was there. And like, as if the cops can, oh, that smells like a quarter pound. No, wait. No, that's at least a half a pound there. Come on, that's just ridiculous.
Tiny little nuggets can odor like a car, a room, a house.
Yeah, exactly.
It's crazy.
And that's the thing. That's the thing the court came up with today, is that the strong smell of marijuana doesn't tell you anything about how much marijuana there is. And that applies to drug sniffing dogs. That applies all over the place. So whenever someone wants to give you crap about it only being an ounce or only being decrim, point them back to a case like this and show how even these little baby steps help a whole bunch of cannabis consumers.
An Iowa jury convicted a terminal cancer patient yesterday for growing marijuana plants, effectively sentencing him to death. Benton McKenzie suffers from an aggressive form of cancer called angiosarcoma and was rushed out of the courtroom on Monday for emergency treatment of the extreme pain and hallucinations his cancer produces. McKenzie was growing 71 plants to produce a cannabidiol oil to treat his tumors. Despite Iowa Governor Terry Branstad signing legislation in May allowing CBD oil for epileptic children, the judge rules that law does not apply to McKenzie. McKenzie was not allowed to mention his medical use as a defense, nor was he allowed to tell the jury about his medical condition. Before his arrest, CBD oil helped McKenzie put his cancer into remission. Since then, it has returned to stage 4. McKenzie faces a minimum of 3 years in prison, which at stage 4 with no medical cannabis will likely kill him. In a recent poll, 81% of Iowans support legalization of medical marijuana.
This is such a needless tragedy. You've got 4 out of 5 people in the state that think he should be able to do this. You've got the governor signing a law that says kids should be able to use this if they've got epilepsy. But this judge wants to go forward, and this state wants to go forward with charges against this guy because he technically broke the law. He was growing marijuana plants. The cannabidiol oil law doesn't apply to angiosarcoma. It only applies to epilepsy. They had to wheel this guy out of the courtroom, because he was hallucinating. He was in extreme pain. When they sentenced the guy, he was still wearing his hospital blanket and the little ID tag. And yet he couldn't tell the jury he was sick. And they still convicted him. And of all the people, of course, I feel terrible for this man and his family, but I also feel terrible for these jurors because they're going to get out of that courtroom. They're going to start reading the paper about this and go, oh my God, what have we done? We just sentenced a man to death and didn't know the full consequences, didn't know the full situation under which he was growing those marijuana plants. I mean, whatever happened to the truth, the whole truth, and nothing but the truth? Well, they don't get to tell the truth in these courtrooms. They don't get to say that they've got cancer. They don't get to say they were growing for medical purposes. And there was nothing about this case to indicate he had ever diverted marijuana away from his own personal medical use to anybody else. And this man's life and likely his death is something that the people of Iowa are going to have to deal with and going to have to make up for in the coming years. This is just so insane that we treat sick people this way over their use of a plant that 23 states now are allowing people to use.
Yeah. Rhode Island's governor has signed legislation to further restrict the state's medical marijuana program. Most of the changes concern medical cooperative grows, which now are limited to 5 ounces, 2 dozen plants, and a dozen seedlings in residential areas. Non-residential co-ops may harvest twice that amount, which 10 ounces, 4 dozen plants, and 2 dozen seedlings. All co-op grows must now comport with zoning and municipal safety codes, and a new right of landlords to refuse to rent to and to evict medical co-op grows has been added to the law. Also, new standards for criminal background checks for caregivers has been established. Joanne Lepanin, Executive Director of the Rhode Island Patient Advocacy Coalition, testified to the Senate Judiciary Committee that, quote, "This is not the time to be talking about reduction in the plants," end quote, because of the patients who, quote, "need a lot of plant matter to make those cannabis oils."
Yeah, this is another situation where you have a working program and they've got to start restricting it and making it more detailed in order to try to keep the healthy people out. We got to stop, they might be growing these plants and might be trying to distribute it to healthy people. By God, we got to stop the healthy people. And whenever we do that, all we do is we make restrictions that hurt patients in some way. They usually don't end up helping prevent diversion in any way. People that want marijuana are going to get it. It's long past time that the people of Rhode Island come along with the people of Colorado, Washington, and these other states that are wanting to legalize marijuana. That's the best possible thing you can do for patients.
Yeah. While the University of Arizona just fired the first researcher to win federal approval to study medical marijuana use for PTSD, Arizona's top health official has approved medical marijuana use for PTSD. Will Humble, the state health services director, announced on Wednesday that, quote, "I have issued a director's decision that will authorize the use of marijuana for patients that are currently undergoing conventional treatment for a diagnosis of PTSD," end quote. The policy won't take effect until January 1st, when Arizona will join California, Connecticut, Delaware, Maine, New Mexico, Oregon, Michigan, and Nevada in allowing medical marijuana use for PTSD. Last month, an administrative law judge ruled that PTSD patients should have access to marijuana, countering Humble's previous decision to continue to ban medical marijuana for PTSD due to insufficient research.
Yeah, just not enough research. We just don't know enough about it. But suddenly, when there's a whole bunch of stink about firing the lady at University of Arizona who was going to study medical marijuana for PTSD, now he comes around to this? Gee, what an interesting coincidence.
About stealing her thunder.
Yeah.
The district attorney in Brooklyn, New York, has effectively decriminalized marijuana possession. DA Ken Thompson announced Wednesday that, quote, "thousands of low-level marijuana arrests weigh down the criminal justice system," end quote, so those caught with less than 25 grams will have their cases dismissed prior to arraignment. This has already been the outcome of most low-level pot possession cases, and Thompson has simply made it a new standard. However, NYPD Commissioner Bill Bratton says this will not change how his police officers deal with low-level possession on the street, presumably meaning pot offenders the DA won't charge will still be arrested and booked. Furthermore, the NYPD insisted that the dismissal of charges won't apply to violent offenders, gang members, those with open warrants, or those smoking marijuana in public, quote, "particularly around children, such as a park, playground, bus, subway, or schoolyard," according to an NYPD press release.
Well, this is just more of the same.